Looks as if my I'm not able to screen share.
You can now. I added the option for you.
Perfect. Thank you. Thank you. Okay, well, welcome everyone. Good afternoon. It's 12:03, so I can officially say good afternoon. My name is Dr. Amy Frankowiak. As Erin said, I am the Assistant Program Director here at the University of Michigan-Flint in the Nurse Anesthesia program. I'm just trying to make it, there we go. And let me get up here to slideshow. And not now. From the beginning. There we go. Okay. Again, welcome. And yeah, so we're going to go over this PowerPoint presentation. And then again, as Erin said, if there are questions after, we'd be happy to answer them. So things that we're going to cover today in this PowerPoint lecture are some program highlights, cohort size, our pass rates, a career in nurse anesthesia, some of our admission requirements or all of our admission requirements, application steps, and then some questions and answers at the end, as I said. And these are just some of our students obviously having a good time on our campus. Some of our program highlights within the DNAP program. It is a pathway to become a nurse, a certified registered nurse anesthetist, capable of providing quality anesthesia care to patients of all ages in all settings. And we do pride ourselves on the fact that the moment that you graduate from our program, you are fully prepared to work in all sorts of settings, whether that be a solo or CRNA only setting or an anesthesia care team model setting. We are ranked among the nation's best nursing anesthesia programs. We do take about 30 new students each fall. We have moved from the Master of Science to the DNAP, and that took place in 2018. We graduated our first cohort of 25 students, I believe it was, 22 students in 2021, just this August. And obviously we pride ourselves on very high pass rates, as you'll be able to see from our statistics. So these are our statistics, as I was saying. Here we have the class of 21 statistics. We have 100% pass rate. First attempt rate, pass rate was 95%. Our attrition, we pride ourselves on minimal attrition, so 0%. And of course, employment within 6 months of graduation was 100%, kind of across the board over the last 4 years, as you can see here, or 5 years. This little gap in time here, we did not have a class of 2020 because we were in the process of converting from our Master of Science to our Doctor of Nursing practice, to nurse anesthesia practice program. So we, as you can see here, our pass rate dropped a little bit here in 2017, and we have made many changes within our program to obviously increase that pass rate. As you can see, we were successful in doing so. This is us. We're highly educated anesthesia experts. We provide every type of anesthesia for patients of all ages, so newborns up to the elderly, for any kind of procedure and in every healthcare setting where anesthesia is required. So we provide general anesthesia, regional anesthesia, whether that be peripheral nerve blocks, epidural anesthesia, spinal anesthesia, sedation, and then obviously pain management as well. And CRNAs administer more than 45 million anesthetics each year in the United States. And I'm hoping this video, will that video not work? Oh, I will show that. I think I'm going to show, oh, it will. There we go. Just had to give it a few. This is a nice, fun video that you can find.
Chris might seem like an average guy in scrubs, but he's actually part of a group of anesthesia professionals who help millions of Americans every day. He's a CRNA. CRNA stands for Certified Registered Nurse Anesthetist. If you've ever had surgery, a CRNA like Chris likely administered your anesthesia and made sure you stayed safely asleep during the procedure. Let's face it, the last thing you want to do is wake up during your surgery. Chris's colleagues make sure you don't, in hospitals big and small across the U.S., staying with you during your entire procedure, monitoring your vital signs, and adjusting your anesthesia as needed. And then, after surgery, Chris will help you keep your pain under control, Like all his fellow CRNAs, Chris has extensive training. That means earning a 4-year bachelor's degree in nursing, then working in an ICU, and then earning a master's or doctorate degree in anesthesia. Finally, he must pass a rigorous certifying exam. That's over 8,500 hours of training. Fact is, you'll find CRNAs in medical settings everywhere. Hospitals, delivery rooms, dentists, podiatrists, and plastic surgery centers, and extensively in the U.S. military and VA healthcare facilities. So next time you're going in for a procedure where you'll be anesthetized, relax. Chris and his fellow CRNAs will be there to make sure everything goes perfectly. CRNAs. Every breath, every beat, every second, we are there. Brought to you by the Michigan Association of Nurse Anesthetists.
There we go. Okay. The career. To become a CRNA, you must first become a registered nurse. And to enter practice as a registered nurse, you must complete an entry to practice associate's or bachelor's nursing degree and pass the NCLEX examination. If you complete your associate's nursing degree to become a registered nurse, you must complete an appropriate science or nursing baccalaureate degree before applying to a nurse anesthesia educational program. And applicants must also practice as a registered nurse in a critical care unit, also known as an intensive care unit, or ICU, for at least 1 year before you matriculate into a nurse anesthesia educational program. Okay. And the average critical care experience for the applicants or prospective students is about, students is about 2.9 years when they enter the nurse anesthesia program. So nurse anesthesia educational programs prepare students to enter practice as CRNAs and take what we call the NCE, or the National Certification Examination, after successful program completion. And to enter practice as a CRNA, you must complete a master's or a doctoral degree in nursing with an anesthesia concentration, a master's degree in anesthesia, or a doctoral degree in nurse anesthesia practice. A doctoral degree to enter practice as a CRNA will be required for all students that matriculate into a nurse anesthesia educational program on or after January 1st, 2022, which is obviously coming up very shortly. Nurse anesthesia education intensive didactic and clinical education and training. CRNAs have the training, the education, and the scope of practice that allows them to perform all the same anesthetic related care and procedures that can be performed by our physician anesthesiologist colleagues. CRNAs are able to administer anesthesia in, like I said, all practice settings for any procedure and to practice throughout their lifespan. To patients throughout their lifespan. So again, newborn babies all the way through into the elderly population. CRNAs have a minimum of 7 to 8.5 years of education and training specific to nursing and anesthesiology before they're actually licensed to practice anesthesia. And averaging about a little over 8,000 clinical hours of training, obviously prior to becoming a CRNA. When we look at curriculum, there are 46 courses and the total of credits is 92. It is completed over 36 months or 3 years. We are a cohort-based program. We are maxed out right now around 30 students per cohort, and all students receive a detailed plan of study as to how their 3 years will go. These are our many clinical sites that we have currently, and we are always working on acquiring more. We are in the process of about 5 more right now, as we're looking to different areas of the state. But you can see they span many areas of the state, so that you're getting the most optimal experiences, whether those be in rural areas or more urban areas. Trauma experiences, OB experiences, cardiothoracic or heart experiences, neurovascular experiences. We pride ourselves on our numerous clinical sites to give those experiences to our students. We look at prerequisite courses, those that are required. So applicants must have a GPA of at least 3.0 from a regionally accredited institution for each of the following prerequisite courses. You can see college algebra, having one of the following, either a quantitative GRE score above the 30th percentile, and that is all we require the GRE for. If you are looking, if you have taken the GRE and you've acquired above the 30th percentile in the quantitative area, you are covered under your college algebra there. Completion of Math 111 with a grade of B or a 3.0 or better. Documentation of successful completion of AP Algebra or successful completion of the Algebra CLEP exam. Statistics, we require a graduate or undergraduate level course. General chemistry for health sciences, which is the equivalent of, in these courses that are in italics, or excuse me, parentheses in italics, are the equivalents at the University of Michigan-Flint. So chemistry 150, or principles of chemistry 1, which is chemistry 260. The labs for both of those courses are not required, but they are strongly recommended. Fundamentals of organic chemistry, or chemistry 220, or biological chemistry for health sciences, which is chemistry 252. A pathophysiology course, which is equivalent of NSC 207. Human Anatomy and Physiology 1, which is Bio 167, and Human Anatomy and Physiology 2, Bio 168. Any single semester anatomy and physiology courses must be 5 credit hours or more. And again, the equivalents there are in parentheses. And you can always on the website refer to the transfer equivalency guide, and it will sort of give you a basis for whether or not the classes that you have taken will actually apply to our prerequisites. Recent repeats of the following courses are required if they've been taken more than 10 years prior to the application to the program. So fundamentals of organic chemistry or biologic chemistry, and then also human anatomy and physiology 1 or 2, excuse me. Applicants that are presently enrolled in a single final prerequisite course may apply for admission consideration only if all other prerequisite courses and requirements have been met. And you'll want to submit that documentation of enrollment with your application materials so that we know that you're finishing up that one last class. And incomplete applications will not be reviewed. Okay, only with everything done, those are the ones that get reviewed. Professional criteria. The following criteria establish the eligibility baseline for admission consideration. So current unrestricted licensure as an RN in Michigan or of one of the United States or its protectorates, a bachelor's degree in nursing or an appropriate biological science from a regionally accredited institution, a nursing GPA of at least 3.0 from a regionally accredited institution, GPA of at least 3.0 from a regionally accredited institution for each of those required prerequisite courses that we just talked about, and then a minimum of 1 year of experience as a registered nurse in a critical care unit or an ICU, such as the SICU, the MICU, the CCU. We also, there is an emergency room or an emergency center at the University of Michigan or Michigan Medicine that we do consider as well. These are all required to matriculate into the program. Other critical care units may be considered, again, just sort of as I was saying with the Michigan Medicine ER, if the applicant has working knowledge of mechanical ventilation, knowledge of invasive hemodynamic monitors like pulmonary artery catheters, central venous pressure catheters, arterial catheters, and is proficient in titration of vasopressors. And we will ask you about those during the interview process to sort of gauge your experience on the level of your ICU, the acuity, that kind of thing. We want you currently working in a critical care unit. You'll have to provide us with evidence of at least 8 hours of CRNA shadowing. And we do have a shadowing form for you to fill out. Current BLS, ACLS, and PALS certification. And due to the length of time that it may take international applicants to become licensed as a registered nurse in the United States, applicants who are pending receipt of a license will not be considered. As far as certifications, CCRN, TNCC, ATCN, CMC, CSC, critical care support, EMT or paramedic licensure, nurse practitioner, RNC, NIC, SCRN, TCAR, PCCN, or other specialty certifications. They're not required, but they do give your application some strength, so they are strongly recommended. The University of Michigan Flint Nurse Anesthesia Program uses a holistic approach to reviewing the applications. So we look at information regarding volunteer experience, professional organization involvement, and leadership experience within your supplemental application. Applicants should provide a detailed description of their involvement in any of these activities. And this additional supplemental information has the potential to strengthen your application. And again, during your interview process, we will talk with you about this just to sort of get a better idea of your, to just give your application a more holistic viewpoint. Application steps. So obviously the application for graduate admission, the $55 application fee, which is obviously waived for you, as Erin was saying. A completed supplemental application to the DNAP. You'll have that shadow verification form. If you do have GRE scores, those can be sent directly to U of M Flint using the code here, 1853. The GRE is no longer required, like I was saying, but it can be used to meet that college algebra requirement, that quantitative score of 30th percentile or higher. Official transcripts from all colleges and universities attended, we'll need those, obviously. You will write an autobiographical essay, and obviously, if it's applicable, a copy of your military discharge. We'll need a copy of your RN license in Michigan, a copy of your certifications, your BLS, your ACLS, your PALS. You'll have 3 letters of recommendation, including one from the dean, from the director, or the faculty member of your nursing program. You'll also have somebody who's a present employer or your supervisor, and then a practicing colleague who is familiar with your work as an RN. And then international students must submit additional documentation, and you can visit the international students page for those details. More really fun pictures. The interview process, applicants that are selected for further review are required to complete the program interview process to retain eligibility for admission to the relevant cohort. So early consideration interviews are conducted in October or November. We just finished those in, I guess it was early to mid-November. And then the regular consideration interviews take place in March. And then interviews are all conducted virtually at this point. Application deadlines. The DNAP program admits 1 cohort annually, and that will begin in the fall semester. So the students that we just got done interviewing will be considered for the fall of 2022. To be considered for admission, you'll want to submit all application materials to the Office of Grad Programs on or before one of these deadlines. So again, the early review is September 1st. The regular review would be February 1st. These are just some estimated tuition numbers, credit hours, in-state versus out-of-state. Doctoral education is a little bit more expensive, so you'll see that. And you can, there's a website here at the bottom for you to see a little bit more in terms of details of tuition. And there are mandatory fees and additional course-related fees that are obviously not included in these numbers. We'll have to take that into consideration as well. So you'll want to follow the University of Michigan Flint Nurse Anesthesia Program on Facebook, and there's our Facebook site. We have lots of fun pictures, we like to celebrate activities, graduations, things like that. So it's really fun. Please do follow us. This is actually the same cohort. This is our first doctoral cohort that just graduated in August of this year. This was one of their first days in the OR at Hurley. Here on the left, and then this is their last day with us, graduation, which was on August 20th of just this past year. So lots of fun, and they're all out in the workforce, working and doing well. So any questions, you can contact the Flint Grad Office, which is flintgradoffice@umich.edu. Also, you can be in touch with Lisa Pagano Lawrence, who is one of our administrative assistants, and she is on this Zoom call currently. And this is a picture of our most recent class that just started this fall. This is the DNAP class of 2024. They are all thriving and doing well and just finishing up their first semester with us. Yeah, I'm going to say that they're loving life. So they're really getting into it and they're excited to start into their second semester to get in some simulation and some fun learning. So that is all.
Does anyone have any questions for Dr. Frankowiak? Please feel free to, just shout them out, raise your hand, or put them in the chat as well, and we can address them.
Yes. I chat up here so I can see.
Hi, my name is Caitlin Robinson. I just have a quick question.
Sure.
Can you talk a little bit about what additions you made to the curriculum when you guys transitioned from a master's program to a DNAP in 2018?
Yes, and I will do my best. I know Dr. Welch is here too, but she can add too. But so obviously the program went from being 2 years to 3 years. We took in our curriculum, actually it was easy for us because we have a complete, well, we still do sort of, it's closed right now, but we are graduating all of our current students, but we have a DNAP completion program. And that's actually what myself and Dr. Welch graduated with. We graduated from this program, the completion program, meaning that we were CRNAs with master's degrees. We went and took the doctoral education or the doctoral curriculum and graduated, and now we're doctorally prepared. We basically took all of those classes and added them into the current entry to practice or the master's entry to practice curriculum. So we were lucky in that it was nice and easy for us to do. We already had the structure and we put them all in. So the majority of those classes are what we call asynchronous, meaning that we don't formally meet. A lot of it is recorded. So asynchronous classes obviously are the ones that we meet with you and lecture live at times, things like that. So we took all of those and integrated them into the semesters to make it sort of even. And hopefully that answered your question, Caitlin. We've also added some wellness activities and things like that to our curriculum. With the addition of that extra year, the requirements for case numbers and things like that didn't change too much from the master's program. So we were able to add other things like wellness, like professional development, those kind of activities that we've added in to the curriculum as well, just to make it a little easier on you for the 3 years that you're with us. Obviously, it's a rigorous 3 years. So we try to make it as fun as possible and enjoyable for you to learn in that environment. Does that answer your question a little bit?
Yeah, it does. Kind of piggybacking off that, are most of your classes right now online, or are you meeting half and half in person or online? How are you guys doing it?
So they are all online currently. What we are meeting face-to-face with is things like some of our wellness activities, although some of them are online as well. And our simulation is all face-to-face. We'll meet in person for that. But everything that we're doing teaching-wise right now is online.
Okay. What are the wellness activities, I guess, if you don't mind me asking?
Sure. So we kind of make them up as we go. We also ask our students for some advice, feedback. We've gone bowling. This was, I think, pre-COVID, if I remember correctly. Bowling. We've gone to a cider mill in the fall. We've also done, last Thanksgiving, we did a fun virtual activity where we, the staff and faculty did crafts, things like that. And we had everybody on the Zoom call watching. So just kind of those activities, we try and make it as fun as possible. We want you guys to smile and laugh and have a good time, even as stressful and rigorous as it is. So those are some of the, again, we're always thinking of new ones. We're always soliciting the feedback from our students.
Yeah, that's cool. Thank you.
Sure. I'm going to answer this one from Emily Williamson. It's in the chat. Is a Michigan State nursing license required for application, or is an unencumbered nursing license from another state acceptable for application? And if I am correct in what I'm saying, I believe you have to have a Michigan license. You'll have to apply. No, you do not. Sorry, Tina.
To apply to the program, you have to have a nursing license that's unencumbered from one of the states in the US or from one of the proctorates. That will allow you to apply for the program. And actually I was just typing out a response as well. So I'll finish that up here in just a second. but once you get into the program, you will need a Michigan license to attend clinicals at our sites. You can't, you have to have a US license or a license within one of the US proctorates, because it does take a very long time to get a US license. You may not be able to get one in time if you don't currently have a US license. So US license is required to apply, but it doesn't have to be in the state of Michigan. So,
But you have to have it to be in the program and
to go to clinicals,
Yes.
correct.
Thank you, Dr. Welch. Any other questions?
I have a question.
Sure.
My name's Rose Pierce. If you hear a baby in the background, he's eating right here, so I'm sorry. I'm just wondering, I know the program length that you said is 36 months, but do you have an estimated time, like per course, or I mean, per semester, that the coursework, I guess hours per week I'm looking for, dedicated to coursework and or clinicals, just trying to gauge time management and what would be doable.
Sure. Okay, so what I can give you is, kind of, how many courses- I'll give you sort of the information per semester. It's obviously going to be different for you and how much time you need to dedicate to studying and preparing and things like that. That's different for every student. But so the first 2 semesters are designed, people say that the program is front loaded. It's really not front loaded. It's just, we sort of ease you into things and that makes time management a little bit better in terms of just kind of getting used to things. The first semester is you just have one day of commitment to us, just one class day. So that's all for your first semester, so your fall semester. And I believe you guys have 5 or 6 classes. So that's the first semester, just one day. Second semester, you have 2 days of class, one day with us and another day on campus, which this is actually in person, which is your gross anatomy lab. So you've got 2 days of 2 days of class, and then we do start to simulate you. So you'll have one other day of simulation. So that's 3 days of the 5 days of the week that you'll be with us or committed to us. And then into that third semester, you've got 1 class day and then 2 clinical days. So you're into clinical in your third semester. And then after your third semester, so 4th semester through the 9th semester, you have 1 class day and you have 4 clinical days. And that 4 clinical days will be a total of 32 hours a week. 36 hours a week. No, 32. 8 times 4, 32. So does that help, Rose? Does that answer your question a little?
Yes.
Okay.
That's
So you're sort of eased into it. So the time management really is, it's obviously very important in every semester, but it gets, this fall semester is really like the transition from the 2 days a week of clinical to the 4 days a week of clinical is really something that the students find is quite challenging. So, and we as faculty are very aware of that, very cognizant of that, and we are always looking to, to prepare you the best we can to make that time management commitment a little bit improved for you. But everyone's a little bit different in terms of how, in terms of their personal lives, what they have responsibility wise and things like that. But we're always willing to work with you and help you and support you.
That's good to know. Just one more question, kind of piggybacking on that. Is there, I mean, we all know life happens, but is there any sort of like pause that you can press and join another cohort if you had to like skip a semester, or not that that's something you plan for, but just trying to explore all of the what ifs?
Yes, absolutely. Dr. Welch, do you want to answer this one?
Yeah, that would be, Rose, that would be very specific to the student. That is not something that the program is built for, though. You should know that. We, this type of program is extremely competitive to get into. And because of that reason, once we seat a cohort, it's really important for us programmatically with our accreditation and with the university that we're able to keep that program cohort intact. And because we seat a full cohort each time, we don't have space for a student to pick up in the next cohort. For example, we have 30 students in the class of 2024. If someone in the class of 2023 decided they needed to take a pause, there's no room for them in the cohort, the class of 2024. It's simply not possible because we have a maximum number of students we can take per the accreditation body. So often those issues are are related to accreditation and we just don't have the option to take another student. So a student would have to maybe sit out a year, 2 years to come back into the program. That's a huge pause and would require a student probably to restart the program completely. So it's very important that everyone, as they're approaching this decision to embark on a journey like this in a very strenuous and challenging doctoral program, that they're prepared, they have a support system in place, and that it would be an extremely rare and unfathomable life event that would cause that to happen, like a major crisis in the family, a major death in the family, something just that you can't even think of about or imagine. But in addition to that, we are very strong and very well versed at supporting our students through a variety of things. And we have been able to successfully get students through a program without much of a pause when huge life events have happened, including death of a child and plane crashing into home. So we are very supportive of our students and really work hard with them to get them through the program once they've made that commitment to us and we've made that commitment to them. But the option to step back often just isn't there because of how the cohorts are seated and accreditation requirements.
That makes sense. Thanks for the clarification.
Of course.
A couple in the chat here. Emily says, how many students are admitted from the early application in September and how many students from the February deadline are admitted? So obviously our cohort total is 30. And it really just depends on our application pool, the students or the prospective students or applicants that we get. For instance, I believe we have chosen 18, Dr. Welch, I believe that's right, from this first the early cycle. And so we would then, if all 18 of them decided to take a seat in our program, we would have 12 left for the regular application deadline to look at. Okay, it just really depends on the applicant pool each year.
Yeah, that's correct.
And then good afternoon, I have 2 questions. This is Joseph or Joe, maybe. First, my supervisor at work has agreed to write me a letter of recommendation. She stated it would be a good idea for me to gain an additional letter from one of the physicians that rounds on our floor. Are we able to submit more than 3 letters of recommendation? And if so, is an additional letter helpful? So we'll address that one first. And actually, I'm not sure that I know the answer to that. And Dr. Welch or Erin, one of you might.
We welcome additional letters.
Okay.
Yeah, we certainly look for that additional feedback. The other reason that that's helpful to ask for additional letters is because sometimes one of your references, especially your non-supervisory reference and non-nursing school reference, sometimes forget and don't submit that in a timely manner. So it's not uncommon for an applicant to ask for maybe 5 letters, 4 or 5 letters, and that's completely fine. We'll certainly, that will get forwarded to us with your application. We'll certainly look at that and consider it in making our decisions.
One thing I want to address about that really quick, the online application will only give you space to put in 3 names. So what we would ask you to do is simply send our office an email after you submit your application with the name, title, email address of those additional recommenders, and then we can send them the form electronically. So it's just a little bit of follow-up work, but we're happy to do that for you.
Wonderful, thank you, Erin. And the second part of Joe's question, let's see. I would like to get my application started, in particular, some of those references submitted. However, I'm scheduled to take the CCRN in March and retake statistics in the spring. Can I submit now and allow my references to submit their letters and amend my application later when I complete CCRN and retake a course? And I believe the answer to that is yes. But what will happen is we will not consider the application to be complete until everything is in for us. Now, that being said, if you sometimes we don't have your CCRN or you take it in the process of applying and us interviewing you, and that's perfectly fine. You'll just get that certification to us when you can. That's not a big deal. Then again, the retaking of the course, just letting us know that you're retaking that one course. You are allowed to be retaking one course. So if you were to take statistics, you can do that. Obviously, letting us know that it has to be complete before you start the program, obviously. Okay.
And Erin, do you have anything to add about that particular piece about submitting things early.
So I would just encourage you to submit your application now so those recommendations can go out and all of your items can trickle in as long as they're in by the deadline. That'll be fine. We send you application updates via email every couple weeks. You can check your application status right online as well. It's updated in real time. So it's a great way for you to monitor things as it comes in if you just submit your application now and take advantage of that waiver too, of course.
And since we're talking about that right now, Erin, would you also mind mentioning what happens if they decide, or how they can defer their application if they decide they aren't ready for this cycle and they have a lot of material in and they don't want to like sort of lose their place with that or lose that material?
Yep. So your application can be deferred for up to 1 year. So say you go and you apply today and then you work with Lisa and it's determined you have 2 prerequisite courses that are missing or you need to retake and you're not eligible for fall 2022 admission. You can defer your application for up to 1 year. We will reuse the same transcripts. You would need to update materials accordingly, like your RN license or those type of things if it's necessary. But you would not have to do a new application and a new $55 application fee as long as you are within that 1 year limit.
Okay, there's another question here from Samantha. Hello, everyone. For the 3 references that are required for the application, which is most helpful to you as the hiring committee or personnel, as the 3rd reference that is familiar with our work as an RN? Let me read that again because I'm not sure if I understand it correctly.
I got this one, Amy. I already read
You
the
do.
question.
Okay, perfect.
So it's up to you. Just someone that's familiar with your practice, whether it's an RN or a physician, it's really up to you, whoever's familiar with your practice. It could also be a clinical nurse specialist, a nurse practitioner, a physician's assistant, just someone who is also able to speak to your practice because they've worked very closely with you in the ICU. So that's what we're looking for.
Okay, thank you.
Sure. And Rachel says, does each student receive adequate clinical hours at hospitals that employ full autonomy CRNAs? Yes, everyone has an opportunity or will get a rotation at a CRNA only facility. We do have a few of them, so you probably won't go to all of them, but you'll go to at least one of them. And if that is something that's very interesting to you and you'd like to go a second time, that is always an option as well, sort of toward the end, once you have all of your other requirements are fulfilled, especially if it's in one of the hospitals where you're going to work. You can actually start at the end of your time with us in class, and you can sort of use that as a time for orientation within the facility.
Yeah, as long as it's one of our clinical sites.
Right, as long as it's one of our clinical sites, yes. I know some hospitals limit what CRNA can do, yes, and yes, so that you'll have sort of an array of clinical experiences that will kind of reflect that, what you can do, versus what you're not really, what they don't allow you to do. So, and that's just different with every place, but we pride ourselves on the amount or the variety of clinical experiences to give you those different options and those different experiences. So.
And we also have many clinical sites that practice in the care team model, the ACT model, where anesthesiologists and CRNAs practice together, but the CRNAs have a very high degree of autonomy within that model. So you'll get lots of varied experience. And certainly one of our priorities is to build autonomy in our students.
Yes. And this question from Kimberly, am I saying that correct? I hope. If you graduated from UM-Flint, would you still have to send in transcripts? And I can't remember, is that?
That's
I can answer that. We will obtain your transcripts for you from UM-Flint. So there's no action necessary on your part. When we receive your application, we will get them.
Any other questions? You're very welcome. Any other questions?
Well, with that being said, we can go ahead and wrap up if no one has any other questions. I will send a copy of this recording to you as well when I send the follow-up email tomorrow. So you will look for that for the waiver information as well as the recording. So you can refer back to it, of course, if you have any questions or concerns. Thank you for joining us
And
today.
there-
I'm sorry, go ahead, Dr.
There's just
Frankoviak.
one more question, it looks like in the chat.
Okay, yes.
It's from Rachel. She says, she asks, how much input do students have in the location of their clinical sites? So we do allow you, we give you, or you have the opportunity to have input on that, depending on where you live, to a degree, right? So we have to make sure you get all of the adequate experiences that you need, and that may not be close to home. Those experiences that you get may need to be, you may need to travel a little bit for those. But we do have you, fill out a little sheet asking where you might prefer to go at least the first couple of semesters. The first couple of semesters, you will be at a site for the whole semester. So that's where your input matters most. And then for your specialty sites and rotations, those get a little hairier, a little more complicated. So they may be a little farther away, just to give you you have to get all the experiences that you need. So that's, hopefully that answers your question.
And depending on where you live, all of your sites may be far away.
Yes.
If you choose to live at a great distance from the program, and there are very specific types of students that can go to each clinical site. So there are only certain sites that allow students in their first year in the program to rotate there for the full semester rotation. So obviously we have to get everyone into one of those sites. And if none of those sites are close to your home, you're going to have to travel a distance. And we can't keep you at the same site. That would be very disadvantageous to you as a student. So it's important that we're able to rotate you. The same thing for specialty rotations. We have certain sites that allow hearts, that allow OB, that allow peripheral nerve blocks, etc. Not all sites are going to allow those types of experiences, and those are required for you to graduate from the program and to be able to sit for the certification exam. So if those sites are all distant from your home, they just are going to happen to be, but we do take it into consideration, and it's something that we do think about and actively are engaged with in the rotation schedule. But the priority is always to get you the experiences necessary to allow you to graduate from the program, to be a clinically excellent CRNA, and to be able to sit for your certification exam. I think it varies, Lindy, on your question about whether or not people move to the Flint area. I think it depends on whether they own a home, if they have a family, if their family is mobile. There are many, many factors that contribute to that decision. A lot of our students will stay with classmates that live in different areas. Some of them will do, a temporary housing type situation. The University of Michigan, Flint actually has a place for students to stay at the Riverfront Center that you can actually rent a room like by the night. That's like almost like a hotel. It's actually an old hotel, and it's very cost effective. It's $40-ish a night. Erin, is that correct? Is that in the ballpark?
It was actually 25.
25. Okay, so it's even cheaper than I thought. Yeah. So you could have that as an option, and some students you could stay there for the semester, etc. But because we're not on campus as much, I think students are, because the sites are sort of all over the place, they're less likely, I think, to move to Flint, at least at this point. But some students do choose to do that.
Any other questions? All right, well, we will go ahead and end this. Thank you so much for joining us today, and we will hopefully see your application soon.
Thank
Bye,
you.
everyone. Thank you.